We entered a competition where we competed for money to fund a project to help our diabetic patients who were food insecure.
We had heard about a discharge meal kit, and this was something that one of our sister organizations had already done, and they had done successfully. We have a pretty large diabetic population. About 35% of our patients have diabetes.
It's one of the most challenging chronic conditions to self-manage. There's no question. So people with diabetes make dozens and dozens of decisions a day that the people around them are not aware of.
We went in and we requested a little over $8,000 for our project. We ended up getting $10,000, so we had a nice big plastic check.
It's essentially like a frozen meal, lower in sodium and mindful of carbohydrates for our diabetic patients. So it's 14 lunch and dinner meals that are medically tailored meals. It's a folder with information on managing your diet and checking your blood sugar. And then we have information on our free diabetes success class. We put them in our delivery transport bag, and the patient can take them home, put them in their freezer, and heat them up and eat them.
We are not ending the care here in these four walls, that it is extending out to the community.
Nutrition is not the only part of it, but it is a big part of it. So they get to practice with healthy food, and then we want to offer them diabetes education, either inpatient with our diabetes educator, or offer them the opportunity to come to one of our free community classes to maybe reinforce some of the information.
I am doing follow-up phone calls and ask patients who receive the meals if they are connected with any diabetes nurse practitioner or endocrinologist, and see if they found the meal kits information helpful.
We thought we were kind of going to be able to just go in and implement it within a couple of weeks, but it took us almost a year of really planning and trying to identify the process and who's going to be responsible for each step of the discharge meal kit.
Our ultimate goal is to really continue this further, not just with our diabetic patients, but other patients with different comorbidities, to continue this and provide them with a similar program.
It's not just the medicines, it's not just the numbers, it's not just the food, it's the whole package. And it's manageable. It's a really challenging condition, but it is definitely manageable with the right support.